Hello and welcome back to the channel. We want to continue with our digestive drugs, digestive pharmacology. Now we want to look at another aspect of drugs that we can use in the digestive system. We have been looking at how we can use drugs to affect the acid. Now we want to talk about the tract itself and its muscles and its content. So we want to look at how we can use drugs to affect the GI tract as it moves in its movement. And there are primarily four ways we can do that. Ideally, when food or substances enter through the mouth, they move by the peristaltic process, which is basically the GI tract moving, and they exit through the anus. Of course, there are a lot of things that could occur in between, but the general transit process, the general transition is like that. So we think about movement forward in that direction. We can increase the movement of the content of the GI tract forward, and we can decrease the movement of the content of the GI tract forward with drugs or medications. So increasing the movement of the GI tract, increasing the movement of the content in the GI tract is basically causing laxation. So the first class of drugs we will talk about will be laxatives or purgatives, and slowing the movement of the content of the GI tract will be going against laxation. So will be anti-diarrhea drugs, and we'll look at those drugs as well. Now, this is forward movement. We can also affect the movement backwards. Sometimes we may want to induce vomiting. Induce vomiting means that we are moving the content of the GI tract back through the mouth. So it's a backward movement. And so we can induce vomiting, and we will look at that movement as well. And sometimes the body itself is having that urge to vomit, nausea and vomiting. And we can use drugs to suppress that urge. So we will look at that type of drug also. So this is going to be drugs that are going to affect the movement of the content of the GI tract. And I'm basically calling it GI motility or peristalsis. So let's start with the first group, the laxatives, drugs that increase the GI tract motility. Laxatives, also called tactics or purgatives. All right. Now, how do these agents work, and for what purpose do we use these agents? Basically, there are two main ways by which this class of drugs work. They loosen the stool, which is the content of the GI tract. They make it softer. They make it less harder, so that it can easily be pushed through the tract forward, like we stated earlier. Or they can also affect the muscles themselves and cause the muscles to move faster, the peristalsis activity to move faster. And a lot of times, an increased bulk and increased softness working together with an increased bowel movement causes the laxation or the purgation. So purgatives are primarily doing one of two or both activities of loosening the stool or increasing bowel movement or doing both. We use these class of drugs for treatment and for prevention. We use them for prevention of constipation, and we use them for treatment of constipation. In the prevention of constipation, there are special groups of patients that needs that type of prevention. For example, if we have a patient with congestive heart failure where the heart is struggling to pump blood, you do not want to subject this patient to any form of strain or stress when it comes to movement, bowel movement. So you want to prevent that, and you prevent the straining by using the laxatives. A patient who has had a post myocardial infarct, we've had a myocardial infarct. After the myocardial infarct, you don't want to subject these group of people to stress when it comes to bowel movement. So you want to give relaxation to help them have free bowel movement. After delivery, you don't want your patient, especially because of the trauma that has gone on, you don't want them to go through stress before they can ease themselves. So sometimes it becomes useful to give a laxative. Anybody who has gone for an operation, especially one that involves the heart, but not only that, after most operations, because of the heart that goes on and stuff like that, you don't want any strain for your patient. Therefore, you may give laxatives to help your patient have free bowel movement. And sometimes they can also be used when you are preparing for diagnostics examination. And in that case, you also want to prevent constipation because you want the system or the tract empty so that you can be able to do your examination. And in treatment, we relieve the constipation. It has also been used sometimes for removal of poisons or toxins. But here we must emphasize that it's not all toxins, it's not all poisons that can be removed through laxation. And you must be cautious, you must be well informed before you try to use that approach. So you always have to do your investigation before you approach it. All right. And finally, it has also been used as an adjunct in anthelmintic therapy, meaning some people, when they take a dewormer, after the dewormer, they want to peg, so they will take a laxative for themselves. In that instance, they use the laxative as an adjunct for deworming, for the anthelmintic therapy. All right. So that is basically laxatives. Now let's look at some types or examples of laxatives. Some examples of laxatives. The first group, which to me is the favorite group, is the bulk-forming roughages. Bulk-forming roughages or agents. Now, I believe these are the best because these are normally food. These are obtained from food substances, dietary fibers. And that means that besides their laxative activity, they also have nutritional purposes, or they may also serve as an important source of food for the so-called beneficial bacteria in your GI tract. So they are very useful for your digestive health. So these are the best as far as I am concerned. There are other examples that we will look at, but as far as I'm concerned, if you can use your food as your way of laxation, you had one step ahead of the general population. How do these bulk forming refugees or agents work? The name indicates how they work. They form bulk. And how do they do that? They increase the bulk of the GI tract, the stool. And in this case, stool is referring to the content of the GI tract. So they increase the stool bulk. And once they increase the bulk of the stool by pull of gravity, it causes an increase peristalsis. causes an increased peristalsis. So in this case, you notice that we are increasing bowel movement through peristalsis. So this one operates mostly through that method. Increases the stool's bulk, leading to an increase in peristalsis. So examples are fruits, and here is not just the juice, but we are talking about the raw veggies, the fiber part, vegetables, whole grains, cellulose, and psyllium, brands as well. So it's very important. I put some examples in picture here. Now, the next example are the softeners, the emollient agents. The emollient agent, the softness. Now, as the name also indicates, this group softens the stool content. So they are stool softeners, stool softeners. And mostly they do so by increasing the water that is in the stool. They increase the water that is in the stool. Now, once they increase the water in the stool, making the stool softer, then your patient can have free bowel movement without straining, So these are the emollient. Examples is Ducosate and liquid paraffin. The third example are the lubricants. The lubricants. Now these ones form a coating around the stool in your bowel, the stool mass, and then they also form a coating on the bowel itself, so that in between those two, they are able to cause less friction. And forming a coating around the stool mass also helps to keep moisture in the stool. Keep moisture in the stool. So once they have formed that coating on both the bowel and around the stool mass, it reduces the friction and therefore encourages the bowel movement. Encourages the bowel movement. They allow your patient, of course, to go for, have their free bowels without necessarily straining themselves. Now, these ones do not necessarily affect the muscles movement, as it were, but they allow the content of the stool or the stool to be easily moved because they become softer and because the friction is reduced. An example is mineral oil. Mineral oil. The fourth example is the osmotic agent. Osmotic agent. Now, these are agents who by themselves are poorly absorbed into circulation, but by themselves are able to draw water onto themselves. So draw water, and because they are not being absorbed into circulation easily, but they are drawing water to themselves, they draw water into the bowel where they are, and by drawing water into the bowel, like the emollients, they are going to soften the stool. So hyperosmotic agents work like the emollients by softening the stool. And once the stool is softened, they are going to encourage bowel movement. By drawing in more water, they also help increase the bulk, this time through water, not fiber, the bulk of the GI tract. And in doing so, they also encourage bowel movement. Now, sometimes the agent used contains some form of sodium. Now, if the agent has some form of sodium, for example, sodium phosphate, we would describe that as a saline laxative. So a saline laxative is basically an hyperosmotic agent which contains a sodium base. And so it's basically the same. It's an hyperosmotic agent. When it is sodium based, then we will call it a saline laxative. Saline laxative. Other examples are glycerin, sorbitol, lactulose, milk of magnesia. And remember, we spoke about magnesia in antacid. So magnesia itself causes loose bowels, causes diarrhea, and that we mentioned over there. So yes, milk of magnesia, magnesium sulfate, magnesium hydroxide. These are all magnesium salts that also act as hyperosmotic agents. So you notice that the salt we are using helps for that purpose. Or the material, the active ingredient is the one that is drawing in the water. It's the agent that is the hyperosmotic agent. It's the one that is drawing water to itself. All right. So milk of magnesia, like the one you are seeing in your picture, Starwin's milk of magnesia, or lactulose, or Epsom salt, which is magnesium sulfate, are all examples of this class. Then we have the direct stimulants or the mechanical agents. The direct stimulants or the mechanical agents. Now, these ones stimulate mucosal nerves. That means they work through the CNS. And there are two main nerves that are of concern, the myenteric plexus and then the bulbar plexus. These two nerves are the ones that are stimulated, and that's why we call them stimulants, stimulated by these agents. Now, what do the bulbar and myenteric plexus do? These are found in the colon and they control motility, peristalsis. And they also increase secretions, intestinal secretions. So by stimulating these agents, we increase secretion, meaning they help soften the content, they help increase the bulk, they help peristalsis, and all these combined leads to the relaxation, and they also prevent the absorption or decrease the absorption of water from the lumen of the bowel so that the stool remains softer rather than harder, increasing secretion, decreasing reabsorption, all of that leading to softness, increased bowel movement. So that is the mechanical or the stimulant. Examples will be senna, misenako, bisacodyl, cascara, sodium picosulfate. Now, because these ones are working through the CNS, through the brain, these ones are usually the ones that can cause addiction. So we have people who become addicted to laxatives, and mostly it is these stimulant laxatives that work through the brain. We do not want to use this for long continuous periods because your patient may become addicted and could not go to or visit the loo without the help of these agents. So you want to note that. So avoid it. Don't use it often. Use it only when needed, and don't use it for long periods. Don't use it for long periods. So that is the stimulant or the bisacodyl, the mechanical agent. These are normally effective, but can also have drastic laxation, can also have drastic laxation. And then we have castor oil, which has also been found to be an excellent laxative. It has other uses in medicine, but because we are looking at laxation, we want to talk about it. It can be found in it can be described as a lubricant. It can be described as one that helps increase bulk because castor oil is quite a heavy oil, stick. So in this note, I chose to put it under miscellaneous. So castor oil is another example of these our agents. Great. Now, what are some side effects that we may experience with laxatives? Common side effects that we may experience. Remember, we say we are causing laxation. So the first common side effect will be diarrhea. We could go too much and lose too much water and stool. So diarrhea, GI tract diarrhea. Sometimes it could cause abdominal cramping and pain. And sometimes patients experience nausea. Especially the mechanical agent that work through the brain, they can also stimulate the brain and lead to some sympathetic reactions like sweating, palpitation, flushing, and even fainting. Now, because we are losing fluids by laxation, it can also result in fluid imbalances. And whilst fluids are being lost, electrolytes like sodium are also being lost. So they can also cause sodium imbalances. And as we stated, the mechanical laxatives can also be addictive. So we can have dependence, laxative dependence, usually through abuse or overuse of the drug. If you have to use laxatives, there are a group of patients that you want to be a little cautious before using these things. Now, these are patients like those with acute abdominal disorders. When the underlying abdominal disorder, the underlying cause of the abdominal disorder is not known, it's not advisable to use laxatives. Or if you have to use it, you use it with caution, simply because you don't know the reason for the acute abdominal disorder, and you could possibly make the situation worse. Forms of inflammation in the GI tract, we do not encourage the use of laxative because it could make the situation worse. Increased bowel movement or muscle movement can result in increased ulceration or increase in the soreness, the ulcers or the inflammation can trigger bleeding as well. So we do not encourage the use of laxative in such patients. So patient with appendicitis, inflammation of the appendix, patient with diverticulitis, which basically is inflammation. Sometimes it can be infected, other times it's not. But this is the colon, and you can see these out pouches being formed in the colon. Now, this one contains a fluid, so this can be infected. This one does not contain any fluids, but these out pouches that are found, that can be found on the colon, are the ones being described as diverticulitis, inflammation of the or inflammation in the colon, which is a diverticula, an out pouch. Or we can also talk about ulcerative colitis or Crohn's disease. Ulcerative colitis being ulcers throughout the colon. In other words, chronic inflammation. And so ulcerative colitis and Crohn's disease are also described as chronic inflammatory bowel diseases. And they cause ulcers in the colon. Now, if the ulcer is spread throughout the whole colon, we will describe it as ulcerative colitis. And if it is spread in parts of the colon, not all the colon, but parts of the colon, then it will be described as Crohn's disease. Crohn's disease. Okay. So here is a picture of ulcerative colitis. You notice the ulcers that are in the colon. And in this case, the ulcer is spread throughout the whole colon. But where we have part of it, so let's say this section may have it, this section is clean, this section is clean, or this section has, that will be described as Crohn's disease. That will be described as Crohn's disease. Ulcerative colitis, you have the full colon having the ulcers. The extent of ulcers is not necessarily described, but just saying that it is found in the whole colon. All right. So that is drugs that can increase the movement, forward movement of the stool or the content of the GI tract. And this is the first class of drugs, laxatives, that we can use to affect our GI movement, our muscle movement, our content movement. Thank you very much. We will look at drugs that will decrease this same effect in our next video. Thank you all. Have a wonderful rest of the day. Don't forget to subscribe and like the page. God bless.